One. So for every device that we will be demonstrating today, you will need to check the chart in physician's order, gather necessary equipment, follow standard precautions and wash your hands, introduce yourself, state your name and department, verify patient, explain the procedure, confirm the operation of device, and apply the device to the patient. You will then monitor their vital signs, and then you will...
Right now, Maggie is setting up a simple mask device. This device is a semi-rigid plastic mask, and the O2 flow rate should be at least 5 liters per minute to prevent rebreathing CO2. A simple mask is usually used for patients who require a moderate flow. It is composed of a plastic mask that fits snugly over the patient's mouth and nose. The mask has holes on each side that are used for exhalation and air entrainment. If the flow rate is too low, an adjustable elastic strap that fits over the patient's head holds the mask in place. A piece of tubing connects the mask to the oxygen source. Extension tubing is usually added to allow the patient more freedom in movement. Patients may feel claustrophobic, and its usage may interfere with feedings. Hazards include CO2 buildup with low flow rates. Do not ever use this at less than 6 liters per minute. When using this mask, consider humidification to keep the patient's mucous membranes from becoming dry. Face masks are used to deliver oxygen to people who don't otherwise get enough of it. They are commonly used to provide relief to people with respiratory disorders.
Now we have a face set. This soft aerosol mask fits loosely around the patient's face and neck, delivers humidified oxygen air at 8 to 12 liters per minute, and delivers an FiO2 of 28 to 100%. This mask, or face scent, is often used as an alternative to an aerosol mask, especially for patients who feel claustrophobic. Also used for burn victims and those who need a high flow. It is composed of a soft mask that fits under the patient's chin and mostly covers the mouth and nose, with an adjustable elastic strap. Contraindications: alternate to an aerosol mask for patients who feel claustrophobia. Hazards and complications: sometimes difficult to keep in place. It is inconvenient for providing medication and oxygenation. However, oxygen concentration cannot be controlled. Skin irritation is common. Overheating can occur in interviews, eating and talking. Assessment of need. Assessment of need. Face sensor used to deliver humidified oxygen or air to patients who cannot tolerate a simple mask.
All right, our respiratory therapist Amber here is going to be placing a T-piece today. What is this, you ask? It's a tube that is a T-shaped device with a piece that connects the oxygen source to the artificial airway. It's also known as the endotracheal tube or tracheostomy. The recommended flow rate when using a T-tube is 10 liters per minute, with a nebulizer set at the appropriate oxygen concentration.
Indications for the T-piece are patients who have artificial airways, require continuous humidification since the airway bypasses normal filtering and humidification process of the nose and mouth. Patients who are mobile because it can pull on it and cause damage to the trachea are a contraindication. Hazards and complications are retained secretions, aspirate bacteria, and cause infection. An assessment of the need for one would be the use for trach patients who are mobile. Alright, so our wonderful respiratory therapist Alyssa here is going to be showing us about a trach collar. What is this, you ask? It's a tracheostomy mask, sometimes referred to as a tracheostomy collar. It is a small mask that fits over the patient's tracheostomy site. An adjustable elastic strap that fits around the patient's neck holds it in place. The mask has an exhalation port that connects to the oxygen source with large bore tubing. The flow rate is usually set at 10 liters per minute with a nebulizer set at the appropriate oxygen concentration. Indications for this device would be chronic O2 therapy needs a tracheostomy patient, comfortable and convenient, allows patient to be more active than with a T-piece. Contraindications is it's not useful for patients with a tracheostomy without a tracheostomy tube. Hazards and complications include extra care should be taken to be sure that the bottle does not go dry. Which heating elements do not have automatic shutoffs, and this could be a potential fire hazard. Also, more moisture will accumulate in the aerosol tubing with heated mist. Moisture that accumulates in the aerosol tubing must be removed frequently to prevent occlusion, blocking of the tube and/or accidental aspiration or inhalation. Assessment of the need for the patient would useful in active trach patients. It is a great alternative to a T-piece to avoid any pulling at the trach site with movement.
Following each of these device usages, you will need to clean up, wash your hands, leave the patient room clean and safe so he doesn't hurt himself, and chart everything that's listed on your papers.
That we are demonstrating today, we will need to check the chart and physician's order, standard precautions. I'll share my separate.
And then clean your hands.
Coming to you straight from Pima Medical Institute. Hi Maggie, how are you doing? Hey Rachel, come back, I'll never let go, Jack. Beth. Hello, Alyssa.